Good morning, Tanya. I'm Alexa Harper, college student nurse. I'm going to be doing a head-to-toe assessment on you. Is that okay?
That's fine.
Okay, can you tell me your first and last name?
Tanya Tuma,
Your date of birth?
3/25/1997,
The year?
2019.
And who's our president?
President Trump,
Okay, and do you know why you're here?
for a head-to-toe assessment.
Okay, so the patient is alert and awake. Speech is clear. The patient's alert and oriented ×4. As the patient was talking, I assessed the skin. The skin color is appropriate for ethnicity. The patient's vitals were 112/68. The pulse was 70, respiration was 16, oxygen was 99%, and the temperature was 98.4. The patient's height is 5'4". She is 190 pounds. The BMI was 33. So now I'm going to move on to the head and the face. I'm going to palpate the head. There's no lesions or lumps. No patches of hair missing. The hair is evenly distributed. I'm going and before this we did the Snellen test, which is test cranial nerve 2. Her vision was 20/20, which means she could see what a normal person could see at 20 feet. So I'm going to test cranial nerve 7. I'm going to have you lift your eyebrows, smile, frown. Okay, so the eyebrows, the eyes, the labial folds, and the nasolabial folds and the corners of the mouth were symmetric and even. I'm going to palpate the temporomandibular joint. Okay, and then I'm going to palpate the maxillary sinus. Just tell me if you're having any pain.
No pain.
And then the frontal sinus.
No pain.
Okay, so now we're going to move on to the eyes. I'm going to test cranial nerves 3, 4, and 6, and we're going to do the 6 cardinal positions of gaze. So I'm just going to have you follow my finger. Okay, and test the accommodation. Okay, the eyes moved in a conjunctive manner. I'm going to do the pupillary reflex. Okay, so both of the pupils constricted when the light shined. Pupils were equal, round, reactive to light, and accommodation. Now we're going to do, I'll go to the nose. So I'm going to palpate the nose. Tell me if you're having any pain. Okay, there's no lumps. The nose is midline and symmetric. Can you lift your nose up? Okay, the nasal septum's even and midline. We're going to test the nasal patency. So can I have you plug one nose and sniff? And the other one? Okay, so the left nostril sounded a little congested, but is that just maybe allergies or you just getting sick?
Yeah, it's the weather outside.
Okay, so that's normal when someone's feeling that way. I'm going to do the ears. I'm going to palpate the ears. There's no lumps or lesions. There's no ear wax on the outside of the ear. I'm going to test cranial nerve 8 and do the whisper test. Orange shirt.
Orange shirt.
Oh, sorry. I should have told you to repeat what I said.
Okay.
Okay. Gray pants.
Gray pants.
Okay, so cranial nerve 8 is intact. The patient was able to repeat back to me what I had asked. Okay, so now we're going to move on to the mouth and the throat. So I'm going to look at the mouth. The lips are pink. They're not cracked. Can you open your mouth? All right, smile. The teeth are intact. They're aligned. Stick out your tongue. Okay, the tongue, this is midline and it's even. That's testing cranial nerve 12. And then I'm going to look on the inside of your mouth. Lift your tongue. Underneath the tongue is shiny, pink, and moist. I'm going to have you stick out your tongue and say ah. Okay, so the soft palate and the uvula raise at the same time. That's testing cranial nerve 9 and 10. Now I'm going to do, I'll do the neck. First I'm going to feel the carotid pulse. Okay, so the carotid pulse is 2+, rate and rhythm is regular. I'm going to do the other side. side. The right side is 2+, right and rhythm is regular as well. While I'm out on the front, I'm going to listen to the carotid, and I'm going to listen for any bruit, which you wouldn't want to hear, and I'm going to use the bell of my stethoscope. I'm just going to have you take a deep breath and hold it when I listen, and then you can let go and we'll do the other side. Okay, so take a deep breath and hold. Okay, you can let it out, and then take a deep breath and hold. Okay, there were no signs of bruit, so that would sound like swooshing. Next, I'm going to look at the parotid glands. There's no swelling in the parotid. The salivary glands right here. There's no swelling or enlargement, and the lymph nodes there would be like swelling right here, and I don't see any of that. I'm going to palpate the preauricular gland. Sorry. Do you have any pain?
No.
Postauricular. Okay. Occipital. While I'm in the back, I'm gonna do the post cervical, which is right on the neck, right there. Okay. I'm gonna do the submental, the submandibular, and the jugulo-digastric right there. And then I'm gonna do the cervicular right here, and the cervicular chain going down the neck. And then I'm going to do the if you can put your shoulders like this, and do the supraclavicular. And there's no swelling or bumps or anything like that, so those are good. I'm going to test the range of motion. If you can just look one way, look the other, up and down. Okay, and then I'm going to have you shrug your shoulders, okay, and look to your left, and we'll go against resistance, and look the other way against resistance. That's testing cranial nerve 11. So now we're going to go to, actually I'm going to have you lay at a 30 to 45 degree angle. If you want to lay back, I'll move the head of the bed up. Okay, the bed's not working, but we would put the patient in a 30. Oh, there we go.
You got it.
30 to 45 degree angle.
No one.
Okay, that's good. So I'll have you look to your left, and you would look for jugular vein distension right here, which I don't see, and we'll look to your right, and you would look right here, and there's no signs of jugular vein distension or pulsations or anything. So while we're up here, I'm actually gonna do, while you're laying back, I'm just gonna listen to the abdomen, and we'll go back to the other assessments, but while she's laying back, I'm just gonna listen to her abdomen. So if you want to lift up your shirt. Okay, so the patient's skin color is appropriate for ethnicity. It's warm, there's no lesions, it's intact. So I just want to ask you, do you have any abdominal pain?
No.
Okay, so first I'm going to listen to the aorta right here, and then the renal arteries right here, with the bell of my stethoscope. And I didn't hear anything, which is normal. So I'm going to stand at the end of the bed, and the patient's abdomen is symmetric, it is flat, and you can see, if you lean closely, you can see the aortic pulsations, which is normal. So now I'm going to listen to the bowel sounds. So So the patient's bowel sounds were active in all quadrants. And then next I'm going to palpate. So tell me, I'm going to do soft and then hard. Tell me if it hurts. This, I'm going to do soft. Now we're going to go deep. Okay, so there's no lumps or masses in the abdomen that I felt. Okay, now I'll have you sit up. Okay, now we're gonna go back to the upper extremities. So I will test your range of motion first. Actually, the patient's skin, it's warm, it's dry, it's intact, it's appropriate for ethnicity. The nail profile sign is less than 160. There's no signs of clubbing. Capillary refills is less than 2 seconds. I'm gonna test the range of motion. So if you can first flex your hands down, your arms like this and flex. Okay, the patient equal on both sides. Can you squeeze my finger? Okay, equal strength in both hands, and then go like this. I'm gonna have you lift up and go down. Okay, strength is equal in both arms. Now I'm going to listen to the lungs, if that's okay. I'm gonna listen to your lungs and your heart. I'm gonna do it all together.
It's fine.
Okay. So first I'm gonna look at the anterior and posterior. They're both symmetric. I'm going to, the skin color is appropriate for ethnicity and it's intact. So I'm gonna listen to the apical pulse, which is in her heart, which is her heart obviously. But first, last step, I forgot to check the radial pulse. So I'm gonna check the radial pulse and then I'll listen to the apical pulse and then we'll listen to the lungs and all that. So. So the radial pulse is strong, which is good. It was 64 beats per minute. The radial pulse is strong on this side, so it's both equal. Then we're going to listen to, I'm going to listen to the apical pulse. Okay, so I was able to hear the apical pulse very well. I heard the S1, S2 sounds. I did not hear any S3 sounds, which would be heart murmur. So now I'm going to do, I'm going to listen to the lungs. I'm going to have you just take, actually I'm going to listen. You can breathe normal. I'm going to listen to the aortic, pulmonic, tricuspid, and mitral valve, okay?
Okay.
So you can just breathe normal. I'm going to listen with the diaphragm and the bell of the stethoscope. First, I'll listen with the diaphragm. Okay, and then with the bell.
Sorry, I'm a little ticklish. It's okay.
Okay, so the heart sounded good. I heard the S1, S2 sounds. Actually, yeah. Now I'm going to listen to the anterior and posterior lungs. So I'll just have you take a deep breath with each sound. sorry.
It's okay.
Okay, no sounds of wheezing or crackles, so then I'll just have you stand up and listen to the back. This. Okay. Okay. Okay, I'm gonna go to the side. Okay, I'll have you just lift this arm and relax it. I'm gonna listen right here. Take a deep breath. One more time, sorry. Okay, and one more on this, two more on this side. Okay, so no sounds of crackle or wheezing. I listen to the bronchial, bronchiovesicular, and the vesicular sounds. Same thing on the back, bronchial, bronchiovesicular, and the vesicular sounds. The patient's respiration rate was regular and normal, no use of accessory muscles, so that was good. Now I'm going to do, so I did the abdomen. Now I'm going to do the lower extremities. So first, I'm just gonna have you hold out your legs for 5 seconds. All right, good. The patient's able to keep both legs up, has good equal strength. I'm going to just,
I can do that.
okay, so the patient's color is appropriate for ethnicity. The skin is warm, dry, and intact. I noticed just some minor cuts. Is that from shaving?
Yes.
Yeah, okay. So if it was someone who had hair on their legs, I would look for even distribution. There's no signs of edema or pitting in the calves, which is good. Then I'm going to check the capillary refill. It's less than 2 seconds, which is good. Okay, I'm going to do the pedal pulses. Okay, they're both 2+. Their rate and rhythm is regular and equal. Then I'm going to have you flex your feet up and push down. Okay, so the strength on both sides is equal. I'm going to have you lay back. So I'm going to have you abduct your legs towards me if you're able to lift. Okay, do you feel any pain?
No.
No? Okay. And then same with this one. Okay, can you bend your knee? Okay. And the other one? Okay, so the range of motion is good for the hips, the legs, and the feet. Now we're gonna move on to the neuro assessment. I'm gonna have the patient sit on the end of the bed. Okay, so I'm going to do a sensory touch. Just tell me when you feel it and if you want to name the location of where I'm touching you, and then I'll just have you close your eyes.
Okay. Forehead, cheek, chin, nose, right arm, left hand, right leg, right foot, left foot.
Okay, and then we're going to do a sharp and dull. I'm going to touch over your body, and you just tell me if it's dull or if it's sharp, okay? All right, so close your eyes. I'll do...
Dull, sharp, dull, sharp, dull, 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 sharp, 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 dull.
Okay. All right. So then we are going to do the deep tendon reflex. All right. So I'll have you lay your arm out like this. Is this a little too high?
Just bring it a little closer. Alright.
There we go. All right. So can you just flex your arm so I can feel for the tendon? Okay. You can relax your arm. No, relax your arm.
Sorry.
Okay, and the other one. And put down. Okay, she moved her fingers. And now I'm going to do the knees. Okay. Okay. And then we're going to have you stand up. We're going to do the Romberg test. I'm going to have you put your feet together, put your arms out, and stand straight. Okay, so the patient's able to, her gait is good. I'll have you walk straight with your heel to toe.
You want to walk
Heel
heel
to
to toe?
Heel to toe. Okay, the patient's gait is good. I'm going to have you do shin, your heel to shin, up and down. Okay. Then I'm going to have you, I'm going to look at your spine. So the patient's spine, the shoulders are symmetric, the spine is straight. I'll have you lean forward. Okay, the spine is straight, thoracic curve in the, stand up, and the lumbar curve. And then, so the patient's spine is good and intact. And then I forgot one thing. I'm gonna have you go like this with your fingers, nose to finger. Okay, one more time. And then I'm gonna have you lay back and I'm gonna do the Babinski sign and test her reflexes. Her reflexes is normal and it's negative, which she's just reflecting the tooth being ticklish. All right, that will complete my assessment.
Thank you.